Welcome to USMLE Step 1, Rapid Review, Key Associations 3. There are 50 questions and answers in this video. What is the association with atrophy of the mammillary bodies? Atrophy of the mammillary bodies is associated with Wernicke-encephalopathy, thiamine deficiency causing ataxia, ophthalmoplegia, and confusion. What is the association with epidural hematoma? Epidural hematoma is associated with rupture of middle meningeal artery due to trauma, usually has a lentiform shaped. What is the association with subdural hematoma? Subdural hematoma is associated with rupture of bridging veins. It has a crescent-shaped. What is the association with dementia? Dementia is associated with Alzheimer's disease. Multiple infarcts is associated with vascular dementia. What is the association with demyelinating disease in young women? Multiple sclerosis is associated with demyelinating disease in young women. What is the association with brain tumor in adults? Brain tumor in adults is related to supratentorial, metastasis, astrocytoma, including glioblastoma multiforme, meningioma, and schwannoma. What are associations with pituitary tumor? Pituitary tumor is associated with prolactinoma and somatotropic adenoma. What are the associations with brain tumor in children? Brain tumor in children is associated with infratentorial, medulloblastoma, cerebellum, supratentorial, craniopharyngioma. What is the association with mixed, upper motor neuron and lower motor neuron disease? Mixed motor neuron disease is related to amyotrophic lateral sclerosis. What is the association with degeneration of dorsal column fibers? Degeneration of dorsal column fibers is associated with tabes dorsalis, 3 degrees syphilis, subacute combined degeneration, dorsal columns lateral corticospinal, spinocerebellar tracts affected. What is the association with glomerulonephritis in adults? Berger disease, IgA nephropathy, is associated with glomerulonephritis in adults. What are the associations with nephrotic syndrome in adults? Nephrotic syndrome in adults is associated with membranous nephropathy. What is the association with nephrotic syndrome in children? Minimal change disease is associated nephrotic syndrome in children. What is the association with kidney stones? Kidney stones are associated with calcium equals radiopaque, struvite, ammonium equals radiopaque, formed by urease-positive organisms such as Proteus mirabilis, Staph saprophyticus, Klebsiella. Uric acid equals radiolucent, and cysteine equals faintly radiopaque. What is the association with renal tumor? Renal tumor is associated with renal cell carcinoma, associated with von Hippel-Lindau and cigarette smoking. Paraneoplastic syndromes, EPO, renin, PTHRP, ACTH. What is the association with primary amenorrhea? Primary amenorrhea is associated with Turner syndrome. What is the association with neuron migration failure? Neuron migration failure is associated with Kallmann syndrome, hypogonadotropic hypogonadism and anosmia. What is the association with clear cell adenocarcinoma of the vagina? Diethylstilbestrol exposure in utero is associated with clear cell adenocarcinoma of the vagina. What is the association with bilateral benign ovarian tumor? Think of serous cystadenoma with bilateral benign ovarian tumor. What are the association with malignant ovarian tumor? Malignant ovarian tumor is associated with serous carcinoma. What is the association with tumor in women? Tumor in women is leiomyoma, which is estrogen dependent, and not precancerous. What is the association with gynecologic malignancy? Gynecologic malignancy is associated with endometrial carcinoma, most common in U.S. Cervical carcinoma, most common worldwide. What is the association with breast mass? Breast mass is associated with fibrocystic change and carcinoma in postmenopausal women. What is the association with benign breast tumor in young woman? Fibroadenoma is associated with benign breast tumor in young woman. What is the association with breast cancer? Breast cancer is associated with invasive ductal carcinoma. What is the association with testicular tumor? Testicular tumor is associated with seminoma, malignant, radiosensitive, and placental ALP. What is the association with obstruction of male urinary tract? Think of benign prostatic hyperplasia when you hear obstruction of male urinary tract. What are the associations with hypercoagulability, endothelial damage, and blood stasis? Hypercoagulability, endothelial damage, and blood stasis are triad, which increases the risk of thrombosis. What are the associations with pulmonary hypertension? Pulmonary hypertension is associated with idiopathic, heritable, left heart disease such as heart failure, lung disease such as COPD, hypoxemic vasoconstriction, and thromboembolic such as PE. What is the association with SIADH? SIADH is associated with small cell carcinoma of the lung. What is the association with white blood cells that look smudged? Think of CLL when white blood cells that look smudged. What is the association with soap bubble in femur or tibia on X-ray? Soap bubble in femur or tibia on X-ray represents giant cell tumor of bone, generally benign. What is the association with onion skin periosteal reaction? Onion skin periosteal reaction is associated with Ewing sarcoma, malignant small blue cell tumor. What is the association with bamboo spine on X-ray? Bamboo spine on X-ray is associated with ankylosing spondylitis, chronic inflammatory arthritis, HLA-B27. What disease is related to Anticenticentromere antibodies? Anticenticentromere antibodies is scleroderma, Crest syndrome. What is associated with stacks of red blood cells? Stacks of red blood cells is associated with Rouleau's formation, high ESR, multiple myeloma. What is the association with extracellular amyloid deposition in gray matter of brain? Extracellular amyloid deposition in gray matter of brain is related to senile plaques, Alzheimer's disease. What is the association with hair on end, crew cut, appearance on X-ray? With hair on end, crew cut, appearance on X-ray, think of B thalassemia, and sickle cell disease, marrow expansion. What is associated with giant B cells with bilobe nuclei with prominent inclusions, ALS-I? Think of Reed-Sternberg cells, Hodgkin lymphoma, with giant B cells with bilobed nuclei with prominent inclusions, Alzheimer's. What is the association with low serum ceruloplasmin? Low serum ceruloplasmin is associated with Wilson disease, capitolenticular degeneration, and Kaiser-Fleischer rings due to copper accumulation. What is associated with antimitochondrial antibodies? Antimitochondrial antibodies, think of primary biliary cholangitis, female, cholestasis, portal hypertension. What is the association with nutmeg appearance of liver? Nutmeg appearance of liver is associated with chronic passive congestion of liver due to right heart failure, or Budd-Chiari syndrome. What is the association with mucin-filled cell with peripheral nucleus? Mucin-filled cell with peripheral nucleus is related to signet ring, gastric carcinoma. What is the association with apple core lesion on barium enema X-ray? Apple core lesion on barium enema X-ray is related to colorectal cancer, usually left-sided. What is the association with lead pipe appearance of colon on abdominal imaging? Ulcerative colitis, loss of haustra, is associated with lead pipe appearance of colon on abdominal imaging. What are the associations with eosinophilic cytoplasmic inclusion in liver cell? Eosinophilic cytoplasmic inclusion in liver cell is associated with Mallory body, alcoholic liver disease. What are the associations with delta wave on ECG, short PR interval, supraventricular tachycardia? Delta wave on ECG, short PR interval, supraventricular tachycardia, think of Wolff-Parkinson-White syndrome, bundle of Kent bypasses AV node. What is the association with boot-shaped heart on X-ray? Boot-shaped heart on X-ray is associated with tetralogy of Fallot, due to RVH. What is the association with rib notching, inferior surface, on X-ray? Rib notching, inferior surface, on X-ray is associated with coarctation of the aorta. What is the association with brown tumor of bone? Brown tumor of bone is associated with hyperparathyroidism or osteitis fibrosa cystica. Deposited hemosiderin from hemorrhage gives brown color. What are the associations with psammoma bodies? Psammoma bodies are associated with meningiomas, papillary thyroid carcinoma, mesothelioma, and papillary serous carcinoma of the endometrium and ovary. Thank you for watching, and please don't forget to subscribe, like, comment and share.